Hello, everyone. My name is Meera Ragavan. I'm a medical oncologist at Kaiser Permanente, and I also conduct research on the financial impact of cancer care, also known as financial toxicity, which will be the topic of today's video. It's no secret that cancer care is exceedingly expensive in the United States and globally. Financial toxicity is a term used to describe the financial repercussions of a cancer diagnosis. These financial repercussions may include direct medical expenses for cancer treatments, which are known to be very expensive, as well as other services and tests such as blood work and imaging that may be required as a part of a cancer treatment. Financial toxicity may also result from indirect expenses such as parking, food, transportation, and lodging associated with cancer treatment. And finally, lost time at work due to time away for treatment and therefore lost income for patients and caregivers can also contribute to financial toxicity. Financial toxicity is also very common for patients in the US and globally. One study showed that up to 40% of patients with a cancer diagnosis deplete their life savings over the course of their diagnosis. Financial toxicity has been associated with lower quality of life, higher depression rates, higher rates of bankruptcy, which can be up to 5% of all patients with a cancer diagnosis, as well as lower adherence and higher treatment discontinuation rates for patients. It's clearly an alarming problem that we need to do something about. One driver of financial toxicity is insurance coverage or lack thereof. So I'll start by going over some basic insurance terminology that may be helpful and that you may see associated with your insurance plan. These are some definitions that may be helpful. A premium is the amount that a patient pays to their insurance company, usually on a monthly basis. Part of your premium, or in some cases, all of it, may be covered by your employer. A deductible is the amount a patient pays before insurance kicks in and starts helping with payment coverage. There is a type of insurance plan called a high deductible insurance plan. These are plans where patients may have to pay on the order of thousands of dollars before an insurance company will start kicking in. For most patients with cancer, they will max out at their deductible because cancer care is so expensive. And so high deductible plans are generally recommended to be avoided for any patient with a chronic illness. A copayment is the dollar amount that a patient owes for a specific service, a test, or a treatment. That's a little different than coinsurance. Coinsurance is a percentage that a patient may owe for a specific service, often outlined ahead of time in the insurance plan. For example, patients insured by Medicare, which are older adults above the age of 65 in the United States, often have a 20% coinsurance for what's called their Part B part of their plan. And Part B of Medicare covers outpatient services like clinic visits and chemotherapy infusions. The actual dollar amount may vary, of course, based on how expensive or how much that service actually costs, but 20% is the standard coinsurance. So that's the difference between coinsurance and a copayment. Okay. In some cases, patients may face insurance coverage challenges. And these are some common reasons that an insurance company may deny a test or a treatment. The first is the treatment or test may be relatively new. Our pace of discovery in oncology is very fast. And so sometimes treatments or tests may not yet be approved by the FDA or may have been approved, but an insurance company may not yet cover the test. Another case where this can happen is a treatment that may be what's called off-label. So this is a case where your doctor may recommend a treatment that's not technically approved for the type of cancer that you may have. But as our treatments become more personalized, there may be cases where that may be your doctor's recommendation to still try the treatment, especially in a more rare tumor type. And in those cases, the insurance company may not cover that drug for that indication, at least upfront. Another reason an insurance company may deny a treatment is they may have a lower cost alternative that they do cover. The problem is, in some cases, that lower cost alternative may be suboptimal care or suboptimal treatments that your doctor may not recommend. And so that may be a challenge. A third reason is that an insurance company may require what's called prior authorization before a treatment can be approved. This is becoming more and more common as a way for insurance companies to keep their costs low. This is where your doctor's office has to request specific approval for a specific treatment or test before it can be approved. Unfortunately, this can lead to significant delays in care and onerous paperwork. And often, treatments or tests may still be denied by insurance companies, in which case It leads to more paperwork and appeals by your doctor's office. So prior authorization is unfortunately causing many delays in care now, but often the drugs that are requested to be approved eventually do get approved. A fourth challenge that many patients with cancer come across is called surprise billing. This is where patients may get a bill in the mail for a service that they thought was otherwise covered by their insurance company. A common example here is for colonoscopies, screening colonoscopies. This is a test done to screen for colon cancer and is recommended for all adults in the United States above the age of 45. Colonoscopies are mandated to be covered by insurance companies, by the government, as part of the Affordable Care Act. However, many patients will still receive a bill in the mail, otherwise known as a surprise bill. This may be for a few reasons. One may be if, for example, the anesthesiologist providing sedation for the procedure may be what's called out of network for the insurance company. The doctor may be employed by a group that is not considered to be part of your insurance company's network, even though they practice at a hospital that is covered by the insurance company's insurance company. Very confusing. Another reason may be that supplies that were part of the procedure, for whatever reason, may not be under the insurance company's coverage for that procedure. This can be exceedingly frustrating, and if this does happen to you, it's important to know who to talk to help address these surprise bills and to not pay these bills before you learn more information about why you got the bill. And I'll talk more later in the video about how to approach asking for help with these issues.